So we were talking about how the motivation for the course came as two different kinds of ideas met in the middle. Both the students who were taking courses to understand therapy and clients who were seeking to understand the process of therapy better. Those two ideas came together and produced what became this course eventually. Similarly, I want to tell you about another two ideas that need to come together. One is the following. Clearly, hypnotherapy is becoming more and more of a mainstream modality. We see more movies talking about it, it's on TV, it's on the radio, more books, more courses on the topic of hypnotherapy. It's becoming more and more mainstream every day. So, as hypnotherapy becomes more mainstream, more and more people are working hard right now to develop the skills necessary to help their clients achieve their objectives. In other words, hypnotherapists are working hard at becoming better hypnotherapists. But that impetus, that work has to be met by an equal degree of understanding on the part of the subject or the client, as we call it, so that a better match can be made. Because the whole effectiveness of anything has to do with a matching of purposes, a matching of understanding. If a person goes into hypnotherapy seeking the sorts of outcomes that cannot be achieved through hypnotherapy, then we're going to create frustration both on the part of the therapist who may not be aware of the impossibility of a particular goal, but also the client is going to feel frustrated. So you becoming more aware of what some of the things that we can do and what we cannot do are, that makes it a better match between your therapist and you so that the outcome can be maximized for everybody. So the time has come, just as hypnotherapists are becoming better educated, the time has come for you and I to also be more educated about the process so that the outcome can be favorable for everybody involved. I'm glad we're doing this because it's going to work out really well. One of the struggles that the client goes through in therapy, and I want to start off in this introduction with this idea, although you may not have thought about this consciously, this is something that marks a person's ability to succeed in therapy or not. This struggle that I'm about to tell you. Think of a surgery, for instance, a medical surgery. In the case of surgery, the patient goes into, let's say, general anesthesia, they're completely gone, the surgeon operates. So think of surgery as a form of therapy, which it is. In this case, the patient, and the word patient already says it all, the patient is completely passive. In fact, the patient is, by some accounts, not even there, under full anesthesia. And the surgeon is doing all the work on the body of the patient. That's one extreme. Then you have a whole industry that we call self-help or self-improvement. That's the person that reads books and goes into seminars and talks and work groups and group therapies, whatever now, and they're trying to improve themselves and heal themselves. So here, in the case of self-help, you have the bulk of the work being done by the person on the person, whereas in surgery, you have the bulk of the work being done by someone else onto the body of the person. The reason I'm telling you about those two extreme points is the following. In conventional therapy, in talk therapy, in psychotherapy as this is called, the client goes through this struggle as well. On one hand, you have the possibility of the person saying, well, I don't know anything, that's why I'm here. So questions such as, well, how do you feel about this or that? Well, I don't know, that's why I'm here. Well, what happened to you when you were, well, I don't know, that's why I'm here. You see, they become so passive. They transfer the responsibility of the work so much to the therapist that clearly nothing can happen. On the other hand, you have the person who wants to manage and drive the entire process. Well, no, I want to talk about this. No, don't ask me about that because this is not relevant to that. No, wait a second now. This is not how you do the hypnotic induction. Aren't you going to tell me to close my eyes? Or should I open my eyes or should I close my eyes? In other words, they're in some ways micromanaging the process. So here you see those two extreme positions. And the question is, what's the client to do? What's the best way to derive benefit from therapy, from hypnotherapy? You have to find your own center. Together with your own therapist, you're going to find your own center. And this is where this course excels, in helping you find your own center between giving up responsibility for your own healing and wanting to take responsibility for the therapeutic process itself to the degree where it becomes a detriment to the outcome. So we want to find the center, the balance, the equilibrium that makes it possible for you to succeed. And as we go through these different talks, you're going to see that you're going to find the balance within yourself and you're going to be able to excel, heal, succeed through your own therapy. And I'm excited about you because it's going to work out well.